Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the implants placed on the lower left hand side and any significant bone loss or infectious episode that we can see on the radiograph. The two implants, the median implant, which is placed in the region of the six, is quite close to the lower left five, whereas the implant placed close to the lower left eight is significantly far away. We see a radio opaque material here, which we cannot identify as to what it might be, and clinically will need evaluation. Now we see a little bit of bone loss on the buccal as well as distal aspect of the mesial implant. This is the sagittal view. On the sagittal view, you can very clearly see that the implant is placed quite significantly close to the lower left five. We see a little bit of bone shadowing around this region. This is the distal aspect of the lower left implant. We don't see a peri-implantitis at this moment, but we do see a radio lucency around the distal aspect of the tooth, which we don't see around this particular implant. The implant is placed slightly buccally. This is the coronal view, which is a front to back view. The implant is placed buccally, which is why there could be some bone loss on the buccal aspect around the crest, but otherwise on the coronal view, we don't see any peri-implant radiolucency on the coronal view. This is the distal aspect where we see a little bit of radiolucency. Moving to the lower left distal implant, which is placed. So this is placed at a slightly different angle, but placed lingually. This is the radio opaque material that we see here. We can't identify what this might be. It does not look to be associated with the implant. It is floating separately. This could be placed at the time of the implant placement or could have been something else. So this will definitely need a little bit of a clinical finding. This implant does not show any peri-implant radiolucency, neither on the sagittal view we can see anything, or neither on the coronal view. This is the axial view, which is the top to bottom view. Here, when we come close to the rim of the implant, here you can see slight bone loss on the buccal aspect here and the distal aspect. But as we move further down, the implant radiolucency comes right here as well. So this is also something that needs to be verified. So if there are any further questions regarding this case, please feel free to reach to our team. We would be extremely happy to help. Thank you.